Group 24's presentation, we chose a material currently on the market known as Enamelast, which is manufactured by a popular brand called Ultradent. And specifically, we'll discuss the flavorless version of this product, although there are other flavors out there. Now, before we dive into the details of Enamelast and discuss our rationale for presenting this product, we thought it'd be beneficial to briefly discuss fluoride and its importance in dentistry and overall oral health. As we've learned in multiple classes, there's a lot of benefits to fluoride in taking it for our oral health, such as caries prevention and reducing tooth hypersensitivity. And without going too much detail about the mechanism, we know that the negatively charged fluoride ions interact with calcium and phosphate in the hard tissue of our teeth to promote remineralization when our teeth experience onslaughts like acidity. And we learned specifically in this class that our hard tissue is made of hydroxyapatite. And we have multiple sources of fluoride intake to promote this remineralization. Ever since the mid-1940s, mineral fluoride was added to our community drinking water to help us prevent tooth decay. And in addition, common materials such as toothpaste and mouthwash have added fluoride. However, the fluoride release and uptake with these daily use products is kind of minimal. You brush your teeth and you only use mouthwash for only a few minutes. And the question arises, how can we expose our teeth to fluoride for a longer period of time to experience all these great benefits? And fluoride varnish was the answer. This dental treatment is a topical fluoride, presenting all the added benefits while prolonging the tooth's exposure to it. And usually it comes as some type of gel that's applied by your dentist, and it's worn for a few hours to a day. And there's many different types on the market, and our group's mainly going to be discussing one that presented a lot of advantageous properties for the patient and the clinician.
MLS was released in 2016. This product is designed to support oral health care. In particular, MLS help prevent tooth decay and reduce tooth sensitivity. The product uses 5% sodium fluoride formulation in a resin carrier to promote continuous fluoride release and uptake. This in turn enhances tooth remineralization. Additionally, Aminolast includes a patent adhesion promoting agent. This enhances the fluoride contact duration, allowing it to remain effective for a longer period. Consequently, the product creates a mechanical occlusion to reduce tooth sensitivity. Secondly, the product is also an option for orthodontic patients. In particular, it can be applied over the existing orthodontic sealant, essentially strengthening their sealant. This added production is particularly beneficial around braces and other appliances, helping to prevent decay in hard to clean areas. Lastly, the product is designed to enhance patient satisfaction. In particular, this has a smooth, non-gritty texture, making it easy to apply evenly on all surfaces of the teeth. It also has a nearly invisible appearance. This ensures that patient can leave the office without visible residue affecting the smile.
So the flavor-free version of the fluoride varnish addresses two major concerns. The first being that a lot of the flavored fluoride varnishes have a lot of allergies linked to them, and they're specifically linked to food allergens. So a lot of patients are afraid that they're going to have allergic reaction from this product. And there was a study found that the caramel flavor elicited the most reaction among patients. So this flavor-free option really gives patients ease of mind when they're going into their appointments. And then secondly, the seemingly fun flavors that this fluoride offers is really enticing and exciting for maybe pediatric patients, but many adult patients actually don't enjoy the aftertaste, especially if they're going to the dentist like in the middle of the day and they don't want to be tasting this because it's normally the last product that they get in their appointment. So the flavor-free option really gives patients increased happiness and satisfaction because they're not going to be tasting any other flavors, so they can just enjoy a flavor-free option of the fluoride varnish.
So there's important factors to know when we are using enamel list. So it's application technique and patient instruction after application, and frequency of application, and patient suitability. So dry tooth surface. Uh, Make sure the teeth are very dry before applying Analyst. This helps the varnish adhere better and improves fluoride uptake. And the thin layer application, only a thin layer of the varnish is needed on the tooth surfaces. Too much can be uncomfortable and increase the risk of swallowing. And to avoid eating or drinking for 30 minutes, this gives the varnish time to adhere properly and begin releasing fluoride. And also no brushing or flossing for 4 to 6 hours. This makes waiting to brush or floss prevents premature removal and maximizes fluoride absorption. In some cases, dentists recommend waiting until the next morning to brush. And avoid hot liquids and alcohol. This can soften or prematurely remove the varnish. And the high caries risk patients. For patients prone to cavities, applications every 3 to 6 months are typical. And sensitivity treatments, it can be applied as needed to relieve dental sensitivity. Children and adults, NMLS is safe for children, teens, and adults, but is especially beneficial for children as a preventative treatment and also allergy precautions.
Another popular brand amongst clinicians and patients is one called 3M fluoride white varnish, which is produced from the manufacturer by the same name. And this varnish has a lot of similar properties to enamel that we've discussed. However, it does have some unique advantageous features of its own. Just like enamel, it has its own patent adhesion. It has its own patent formula, and it is tricalcium phosphate with added sodium fluoride. And this special tricalcium phosphate formula is only found in 3M, and it's to further promote that tooth remineralization we discussed in the beginning, and to treat hypersensitivity. And just like we learned in class, you can see there's three images in black and white that show the dentinal tubules, which are a gateway to hypersensitivity that flow within the tubules. And this varnish occludes those open tubules and then penetrates them, preventing that flow of fluid and the transmission of ions in the tubules. And through this, we can reduce pain and sensitivity in the patient with 3M varnish. Sorry. Another attractive feature of this varnish is that the tooth actually doesn't have to be dried or polished prior to application, like Steven discussed. So we don't have to go through those extra steps. This saves us a lot of time and makes the treatment a lot easier for both the patient and the clinician. And because of this, the varnish can even be applied on top of plaque or brackets. So this application process is very easy. And it's also simpler in that a horizontal sweeping motion can be used with this applicator, and you don't have to individually paint each of the individual tooth surfaces like you would have to with enamel. And you can even go a bit on the soft tissue, but you should avoid too much exposure of the material onto the soft tissue. And like enamel, it has an extended release formula up to 24 hours for the fluoride. And here I just included a chart of all these different factors for consideration when choosing between these two competing products. Many of these were already discussed, but I want to highlight that after doing the math, the dollar per milliliter cost for Enamelass is cheaper than 3M by almost $2. So one's $4.47, one's $6.28. And the fluoride release after 24 hours and uptake is higher for Enamel compared to 3M. And this is extremely important because this is a major consideration we want to have when manufacturing a varnish for patients. And a disclosure I have is that those numbers for release and uptake I attained from Enamelass. However, 3M did have their own technical data sheet, and although the numbers were different, the numbers for release and uptake by 3M were still presented to be lower.
I've listed three main reasons why our group would absolutely recommend the product to be used throughout general dentistry practice. So the first one is taste sensitivity. So without a strong, distinct flavor, patients with sensory sensitivities could become more likely to elect for the fluoride varnish at the end of their appointment. And then children can be sensitive to unfamiliar tastes. So by using flavor-free, we can prevent patients from making a sour face. Another one is that there's going to be a less mix of flavors. So this product has a shorter waiting period compared to what it used to be. And patients who go to eat or drink after their appointment will not have to worry about the lingering flavor from their fluoride treatment. And then it's also allergen friendly, as Lauren stated prior, that caramel was a flavor that caused a lot of reactions. So patients who are allergic to any artificial flavoring will no longer have to elect not to receive the fluoride treatment at the end of their visit.
That's it. Thank you very much. Here are our references.